Ever since the award of our Royal Charter, and that's now 64 years ago, we've had a sustained commitment to the health and wellbeing agenda. That commitment was accelerated in the early 1970s, of course, with the opening of our new medical school here in the background. So health and wellbeing remains a central focus for our new campaign.
1 in 600 children get cancer. A quarter of all children who get cancer get them in the brain.
We have a project that is aimed to reduce the delays in making the diagnosis.
With this blood test developed, finding these autoantibodies, you can potentially move diagnosis forward several years.
20 years ago, finding a blood test was still the goal, but was almost, people thought, was unattainable.
This is a major step.
We can understand genes and how they're controlled. Now we can make antibodies that are not rejected by the human immune system and that can eradicate tumours, and that's something that's really important today.
The number of MRSA blood infections and C. difficile infections in hospitals is falling, but we still have some way to go. But the problem is there are other things coming along as well.
If something doesn't work, or say antibiotic resistance is increasing, we have to be thinking, well, what else can we do to get rid of infections?
Pain is the number one symptom for people with arthritis. It's very complex, is pain. And the need to bring different experts together to try and crack this was clearly essential.
What we're achieving here is research into the mechanisms by which children become obese.
The more you know, the more questions that there are to be answered.
Which one's the shoe?
If we can understand what's happening to children in those early years, then it's a real time when we can go in and we can intervene. That seems to me the best thing that we can do for our children in society.
Now, there used to be a time when there was a nihilism about dementia because there isn't really a cure, so people would assume that nothing could be done. But really, nothing could be further than the truth, because a lot can be done even if you can't cure.
What we're aiming in rehab is to maximise patients' functional recovery.
We can say, yes, this is what's really important.
Our university is a great heritage, but we do need to build on it. Over the next 5 years, Impact, the Nottingham campaign, will raise £150 million. This campaign will progress major and diverse research programmes and seek to embed research evidence into clinical practice to significantly improve health outcomes and the quality of life for patients and for carers.
Some of the instruments and tools that we've devised are being used all around the world now to assess young carers and to assess the extent of caring that they do and the positive and negative outcomes for them on their caring roles.
The challenges of adapting models of palliative care from the 20th century are very considerable. Our research programme is aimed at developing models of palliative care and interventions for palliative care and education for palliative care to meet those challenges.
It's 11 years riding from John O'Groats to Land's End. We're doing it because we wanted to do something that would raise support for research in palliative and end-of-life care. That I hope will encourage, inspire others to support the campaign. Health and Wellbeing is part of the University of Nottingham's new appeal that is delivering the university's vision to change lives, tackle global issues and shape the future. Do something inspirational today, make a gift and have a lasting impact on tomorrow.